The Not On Tobacco program is the American Lung Association's facilitator-led smoking cessation program for teenagers aged 14 to 19 in primarily school-based settings. The purpose is to educate teens on the health risks of long-term tobacco use using age-appropriate content, providing information on the quitting process, and establishing tools to sustain cessation long-term. NOT is a voluntary program that is held over the course of 10 weeks and consists of weekly 50-minute group sessions. Each group is intimate in size, comprised of no more than 10 to 12 same-gender adolescents, led by a same-gender facilitator. The facilitators are mandated to complete an 8-hour training course set up by the American Lung Association, which includes facilitation techniques, skills development, and specific instructions for each session throughout the program. The goals of the program are to help participants either reduce the number of cigarettes smoked or quit completely, increase healthy lifestyle behaviors including physical activity and nutrition, and improve life skills like stress management, coping, and decision-making. Early intervention and implementation of the teen smoking cessation program, Not On Tobacco, demonstrated positive and sustained smoking behavior change among the youth involved. There are many factors that can influence the likelihood for impressionable youths to participate in risky behavior. Factors such as poverty, lower education levels, and teens living in rural areas tend to have higher smoking rates across the country. Different demographic backgrounds are also an important factor to consider when designing targeted intervention. This study was conducted using match design, meaning each NOT school was paired with a brief intervention school, where students only received a shorter 5 to 10 minute education rather than hour-long sessions for 10 weeks. Due to the need to match schools with similar demographics, there was a limitation on which schools were able to participate in the study. The sample from one Florida program was largely comprised of white teens, while another Florida program was primarily Hispanic. The data collected in the end of the study was then pulled together into one report finding. With a biased sample size, it is impossible to generalize conclusions for a larger population. What may have worked for one population may have an insignificant impact on another population of different ethnic backgrounds. Another factor to consider during design study is location. Youth in rural environments were surveyed and found more likely to have higher smoking rates and smoke at a heavier frequency than those in non-rural states. In other more urban areas where the NOT program was conducted, quit rates were much higher after 3 and 6 month follow-ups were completed. Given the differences in program results, it is important for researchers to tailor the content of the program to address different demographic dynamics. The results regarding effectiveness of the NOT program are impacted due to the fact that it is a voluntary program rather than punitive, meaning the teens who enrolled in the program were already motivated moderately to quit. By offering a facilitator-led support group along with education and tips for cessation maintenance, the teens who were contemplative prior to participation could have been provided with the last piece they needed to achieve the program goals of smoking cessation. Therefore, program success may not be directly correlated to the NOT program curriculum and protocol. In order to appeal to diverse demographic dynamics and ensure the program was provided in an appropriate manner, the NOT facilitators were allowed to make variations to certain activities as they saw fit. Staff members from the American Lung Association monitored the changes during each step to ensure that the protocols of the program were still being followed and ensure progress towards the program goals. Most often, the changes that occurred revolved around the duration of each of the discussion sessions. This could have allowed for the program to be run in school districts where time was an issue, or if there were concerns related to transportation. It was also determined important to separate each group session by gender, having same-sex groups throughout the 10-week program. Having a separation between genders may offer an opportunity for teens to focus on the program at hand and allow the groups to have a facilitator of the same gender that may increase the feelings of security. With startling data related to smoking in the adolescent age groups, the NOT program focuses on impacting this public health crisis in many different communities. Most teens who start smoking tend to continue to smoke as adults. Consider the statistics that 70% of adult smokers were doing so daily by 18 years old. With this being national data, all communities across the country would benefit from a proven and established smoking cessation program. The NOT program is nationally recognized and developed by the well-known American Lung Association. By having an affiliation with the ALA, it provides a level of confidence behind the program protocol and the expectation of results. By including parents in the process of enrollment for their children and keeping the focus school-based, the program can be adequately supported. The NOT program was conceptualized by the West Virginia University Centers for Public Health Research and Training, which is a Center for Disease Control and Prevention supported prevention research center. They had been conducting research on teens who smoke and wanted to develop an innovative smoking cessation program to create a plan to help reduce teenage smoking rates. A partnership was then formed with the West Virginia State Health and Education Departments, the Coalition for a Tobacco-Free West Virginia, and the American Lung Association. This partnership grew into the development of the initial version of the NOT program, innovative for the fact that it was a quit smoking program specific to teenagers. By forming a partnership with the ALA, a nationally recognized organization with an overall goal to reduce smoking rates in the country, it provided the West Virginia University researchers with the backing to move forward with the developmental stages of the NOT program. Since the NOT program is primarily conducted in school-based settings, the external stakeholders would be the schools that agreed to participate in the initial run-through of the program. This includes the schools as well as the trained facilitators that led the groups. Both the schools and the facilitators are a required factor for this program because they are responsible for recruitment of eligible participants, i.e. teenagers who smoked. Without the school's involvement, there would be no location or teens available for participation. The program has been evaluated and proven effective by many studies and has shown quit rates between 15 and 19%, which is the highest rates reported in literature. Due to this, it has gained recognition as a Substance Abuse and Mental Health Services Administration evidence-based model program, a National Cancer Institute research-tested intervention program, and an Office of Juvenile Justice and Delinquency Prevention model program. Having formal recognition from national organizations such as these is a valuable resource because it confirms that the program has been tested and proven effective. The NOT program was funded by a number of grants, both at a national and state level. The grants were obtained by the CDC, Prevention Research Center, West Virginia Department of Education, National Office of the American Lung Association, and the American Lung Association of Florida. Other unspecified costs during the program were paid for by state tobacco initiatives, state and local school systems, and public and private grants. The American Lung Association is the primary source of funding. They own the rights to the program curriculum and trainings of all facilitators. During the development and implementation of any program, it is important to take into consideration the ethical implication of the program's curriculum and ultimate goals. With the creation of the NOT program, it was necessary to consider ethical values due to the targeted adolescent age group and the risk behaviors the researchers were looking for, tobacco use. Given that this program involves minors, parental consent is required in order to protect the rights of the youths involved. This program is run primarily out of the school-based setting. There is an obligation of the schools participating to notify all parents and guardians of the programs being offered through the school system. Parents were first given the opportunity to notify program facilitators if they did not approve of their teens' participation, defined as passive consent. This eliminated the need for certain teens to obtain parental consent before the program even started. With active consent, the teens who did wish to participate were required to discuss the program with their parents and obtain written permission to take in part of the research study. By establishing protocol for obtaining permission, the researchers protected the rights of the minors involved by ensuring their parents or guardians were made aware and educated about the program content and outcome objectives. In regards to recruitment of schools, there was a concern that it would be unethical to ask a school to participate in the study but then assign them as a control. The schools would be under the impression that there would be a delivery of a smoking cessation program in order to help support the goal of reducing smoking among the youth population. In reality, certain schools that were selected would actually act as a control in order to analyze the success rate seen and would not actually be offered training and technical support from the NOT program. In order to fix this, the researchers instead found new schools that had similar socioeconomic backgrounds in order to compare the results of the intervention schools instead of randomly assigning schools that had been picked during the first round selections. The primary opponent to the implementation of this program is the tobacco industries. Statistics have shown that close to 90% of people who use tobacco products had started before they turned 18 years old. By targeting the adolescent population, the tobacco industry's hope is to hook people at a young age in order to optimize the profit potential throughout their lifespan. They want teens to see smoking as appealing by marketing their products through celebrity endorsement and magazine advertisements to draw away from the serious life-threatening health problems that are correlated with tobacco use. By implementing the NOT program, the trained facilitators can discuss the addictive qualities of the nicotine within the tobacco products, provide a safe and comfortable environment for discussion on peer pressure, and provide coping skills for cessation support. It provides the opportunity to address the real long-term health risks and expansive costs that are often overshadowed by a glamorous view implanted into Hollywood by the industry in order to drive up profit. Social factors play a large part in the decision for a youth to start smoking, as many are at a point in their lives where they are trying to figure out where they fit in. At an impressionable age, decision-making skills are not always well honed, and it can be easy for another youth to influence the decision being made. This can increase the amount of teens who do decide to start smoking after having influenced by the peers around them. Although 65% of teens who smoke on a daily basis were interested in quitting, most are unable to do so on their own. By addressing the concerns with tobacco use in an interactive and facilitated manner at a young age, it can lead to better outcomes than addressing these issues later in life. From an economic perspective, money is required to see any program grow from conception to implementation. The NOT program had many well-known supporters, including the American Lung Association and the Center for Disease Control and Prevention, supporting its purpose. The financial support allowed for student and school recruitment funds, training for the facilitators, and support for analysis of the study to determine outcomes. When one considers the economic impact for the youths involved, by addressing the expensive habit such as tobacco use, there is a potential to save a huge sum of money throughout the teen's entire life. Tobacco products are heavily taxed across the country, and those tax rates can vary state by state. Many of the at-risk youth who participate in illicit behavior such as tobacco use tend to be from lower socioeconomic classes. Increasing the price on tobacco products has been proven effective in reducing smoking, especially among the low-income youth population. This, along with an early intervention-based program like NOT, would provide information and motivation for the teens. In order for any public health-based program to have support within a community, it is important that the population understands the program's relevance and long-term benefits if initiated. Marketing is a key component to sharing information on health disparities and the need for intervention in order to improve health outcomes. Basic recruitment posters such as these are a great way to share information about the program and provide a take-home for those who may be on the fence regarding the need for such a program in the community. In terms of smoking cessation, it would be imperative to share smoking rates among the adolescent age group within each targeted population being petitioned to run the NOT program. In doing so, it would start the conversation about the concerns for the youth at risk and importance of finding a way to make a change. Parents focused on their child's future and success may find it shocking that almost 4,000 youth initiate tobacco use every day. Should they continue into adulthood, they may spend an average of over $75,000 in medical care related to their smoking habit. Information that could directly impact their kids would drive forward momentum towards making a change in their community. By showcasing the effectiveness of the NOT program in other communities, it would help to build confidence that the time commitment for training and rollout of the program, along with potential financial expenses, would be worthwhile in the long run to protect the youth involved. A public forum or town hall style meeting, which invites the public to engage in an open discussion with the program developers and school administrators, would be a perfect opportunity to share previous successes, such as the end-of-program cessation rates, which are between 15% and 19%, as previously noted. While presenting the program, being open in regards to how the program is run would help make the parents feel involved in the process and provide assurance that there will be success and change upon completion.